Okay, great. Okay, I think that 5 seconds is up. So hello again. I am a volunteer for HICAP. HICAP is Health Insurance Information, Counseling, and Assistance Program. And this is actually a federally funded program, which is found in many states. Every state has some way of helping people to navigate Medicare. The money comes from federal funds. In Suffolk County, HICAP is administered by the New York State Office for the Aging, and it's administered through the Retired Senior Volunteer Program of Suffolk, RSVP Suffolk. And what we do is we provide free and unbiased information about Medicare and Medicare-related health insurance and financial assistance. We're not allowed to really make recommendations for you, but we try and give you as much information as possible so that you'll understand the system and what kinds of things are available to you to help you to make your own decisions. And all of the information is provided by volunteers. We go to various libraries. I go to a senior center in Huntington. And right now, of course, we're not doing anything in person, but we do one-on-one counseling by telephone right now. So I'm going to sort of give you a high-level Medicare Basics introduction, not go into too many details. If you have some more detailed questions, I'll try and answer them. And I'll also give you some places to go where you can get more detailed information also. But what I want to do is answer some key questions. What is Medicare and how does it work? How should I get Medicare? Because there's really two major ways of getting your Medicare and being covered by Medicare. And when and how do I enroll? What plans should I choose? There are a number of private plans that are connected with Medicare and how you get Medicare. And then when can I change my plans? And the short answer to that is right now, because we're in fall open enrollment. And then you'll see that there are a number of costs to Medicare. And so there are also a number of programs that can help you with those costs. So we want to answer the question, can I get help paying for Medicare? And then finally, where can I go for more help? And then as Danielle said, if you have any questions at the end. So what is Medicare? How does it work? Well, first of all, primarily it's a federal program. And it provides health insurance for people who are age 65 and over, but also provides health insurance for people who are under the age of 65, for those who are receiving Social Security Disability Insurance, SSDI, for a certain amount of time. And usually that amount of time is 2 years. So once you have received SSDI benefits for 2 years, then you are actually automatically enrolled in Medicare. It's also a program for those under the age of 65 with kidney failure requiring dialysis or transplant. So it's not only for people over the age of 65, but also for certain people under the age of 65. There are different parts to Medicare, and this perhaps is something that makes it a little bit more complicated. So there's Part A, which consists of your hospital or inpatient benefits, and Part B, which are your outpatient benefits or your doctor's visits. And Part A and Part B are known as original Medicare. When Medicare came into existence in 1965, that's all there was. There was Part A and Part B, or original Medicare, and it was totally administered by the federal government. There's also a Part D, or a prescription drug benefit, which came into effect, I think it was in 2006. And that is administered all through private drug plans. Now, there's also something called Part C, or Medicare Advantage plans. And you may be seeing all of those advertisements on TV. I know I see them all the time because of open enrollment right now. Medicare Advantage, or Part C, is a different way of getting your Medicare. It's basically, it consists of Part A and Part B, and most of these plans consist of Part D, or drug plans, as well. It's basically a private health insurance plan. So basically you choose the plan that you want, the private plan, and you enroll in that plan. You're still considered to be on Medicare, and your benefits are the same, but the way the insurance plan administers those benefits can be very different. So it's not a separate benefit. Everyone with Medicare Advantage still is considered to have Medicare. Now, that's where you need to decide how you want to get Medicare. Do you want to get Medicare through what's called original Medicare, or do you want to get your coverage through Medicare Advantage? So step one is how you decide you want to get your coverage. If you decide on original Medicare, that consists of Part A for hospitalization and Part B for outpatient visits, usually doctor's visits, but it does not consist of a drug plan. So you would then be able to purchase a drug plan. These are all private drug plans, and you'd have to make a decision on which drug plan that you would want to enroll in. And I'm going to be showing you what those look like in a second. If you are deciding to take your Medicare through Medicare Advantage, then many of those Medicare Advantage plans include a drug plan. Some do not, because people are getting their drug plan or their drug benefit coverage through something else, for example, through Veterans Affairs or something, or maybe through their work plan, if it's their secondary plan. So you don't have to get a Medicare Advantage plan with a drug plan, but most people do. Now, if you are getting your Medicare as original Medicare, you're going to find that there are a number of deductibles and co-pays and co-insurance that I will show you what all of those are. So a lot of people like to purchase or enroll in a Medicare supplement plan or Medigap. We're also seeing a lot of things being advertised on TV for your Medigap or Medicare supplement insurance. You can only buy a supplement if you decide to take your Medicare as original Medicare. If you are taking your Medicare through Medicare Advantage, then you would basically stop there. You are not allowed, insurance companies are not allowed to sell you a supplement if you have a Medicare Advantage plan. So you don't get a supplement with Medicare Advantage. You do, or you're allowed to purchase a supplement if you have original Medicare. Let's see. So what are the differences and how do you make this decision? Original Medicare is the traditional program. Originally, remember I said it was started in 1965 and it's administered directly by the federal government. It's accepted by most doctors and hospitals in the United States, and that's probably the clincher for a lot of people because you can go to any doctor wherever you are in the United States as long as that doctor accepts Medicare, and the hospitals as well. You must get a separate drug plan, and you may also purchase a supplemental insurance to help you to pay a lot of your out-of-pocket costs. Now with Medicare Advantage, these are Medicare benefits through a private health plan, but they must offer the same benefits that original Medicare offers. It's just that they offer them in different way with different co-pays, with different co-insurance, different rules about what they have and what you can do. They're often limited to doctors and hospitals that are in network. Either they're entirely limited for an HMO, so that if you go out of network, they will pay nothing, or a PPO, which you can go out of network of the doctors and the hospitals, and they will cover some of it, but not all of it. And so you'll have high co-insurance at that point. You usually, though, can get a drug plan from the same Medicare Advantage plan. So a lot of people like this because it's considered to be one-stop shopping. And another benefit of Medicare Advantage is they also may offer additional benefits that original Medicare doesn't offer, such as hearing, vision, and dental. So that's often an advantage to a lot of people. You have to be really careful about what they offer because sometimes it's minimal. So you really want to check the details to make sure that to make sure of what they are offering. So how do you decide which plans to choose? And I think this is one of the most confusing parts to Medicare because there's so many plans to choose from. So I mentioned with original Medicare, you can purchase or enroll in Medicare Part D. Original Medicare doesn't include a drug plan. So if you wanted to get original Medicare, then you would basically look at the standalone prescription drug plans. And these are the ones that we have for 2021 on this page as well. And you can see that they all have different monthly premiums, 1, 2, 3, 4, the fifth column across. A couple of them have very low premiums, like the third one, Aetna Medicare Silver Script Smart RX at $7.30. But they also can have very high annual drug deductibles. So that particular one, for example, has a deductible of $445, which means that the drug plan doesn't really kick in until you've spent that much money out of pocket for your drugs. For some drugs, it's easy to do very quickly. For other drugs, it's not. And so you're not using your plan at all. The other thing I wanted to just show you, if you decide that you want to sign up for a drug plan, then these are the phone numbers. Or you can also go on www.medicare.gov and it will list the plan. It will show you the plans that exist in your particular zip code, and which is basically all of these plans will be the ones that you would have available to you. But if you go onto the Medicare website, medicare.gov, and enter or type in all of the drugs that you're taking, then it will show you every single plan and how much it will cost you each year for each plan. You can line them up in the order of the cheapest first, and you can see first of all, which would be the cheapest plan for you given the drugs that you're taking, but also some drugs are not covered in certain in the formulary or the list of drugs for each plan. And so you want to make sure that the drugs that you are taking are actually covered in the particular formulary of the particular plan that you enroll in. Okay, so there are two ways to do it. You can just look at this table really, and just go precisely by the premium and the deductible, but you can also go onto the Medicare website, and I recommend doing that. And we can help you at HiCap if you want to talk to a counselor. We can certainly help you to go through that. Now, I mentioned before that there are costs to Medicare. I wanted to show you what some of those costs are because that's where some of the supplements come in. So for the Part A, there is a premium for Part A, but for most people who have a work history or their spouse has a work history, then Medicare is free. Part A is free because you've been paying into Part A your whole work history life. And so, but if you don't have a work history, then Part A can cost as much as $478 a month if your work history is limited. Now, also, if you are to go into the hospital, there is a deductible of about $1,400 for each benefit period. Now, benefit period is, it begins the day that you're admitted into the hospital as an inpatient, not as an outpatient, say an emergency, but as an inpatient. And it ends after 60 days have passed and you haven't gone into the hospital again. Now, if you go into the hospital after those 60 days, then a new benefit period starts. So it's possible that you will have to pay more than one deductible per year. The other thing you get with Part A, with Medicare, is you get the first 60 days in the hospital free, but after that, you're going to have to start paying a hefty amount for each day that you're in the hospital after 60 days. If you are in a skilled nursing facility like rehab, which generally would be free if you've been in the hospital overnight as an inpatient for 3 nights, then the first 20 days in rehab or in a skilled nursing facility is free. After that, it costs $181.50 for days 21 through 100. These are all the costs, by the way, for 2021, and they could change slightly, but you get an idea of what they will cost approximately. Now for Part B, remember that's your outpatient visits, that's your doctor's visits. Instead of paying into some sort of a fund over your working life, the way that gets funded is through premiums. And the premiums, as you can imagine, have been going up over the years. Right now, the premium is about $144.60, and it could be more. It depends. It might go up in 2021 to $153.30. And we're waiting to find out whether there's going to be a cost of living increase for Social Security. So if there is an increase, then Medicare costs will go up. If there's no increase, then Medicare Part B premium will stay the same. And also, if your income is higher than $87,000 as a single person or as a couple, $174,000, then your premium will be higher than what you see here. There's also a deductible for Part B, so that Part B or doctor's visits don't really kick in, the coverage for them doesn't really kick in until you've paid that deductible. And the deductible has been going up over the years also. And for 2021, it's estimated to be $212 a year, one-time payment. And once you have paid out of pocket $212 for Part B services, then your Medicare Part B starts, but not until you've paid out of pocket $212. And then there's 20% co-insurance if you go to the doctor. I think you see this on TV a lot, where Medicare pays for 80% of a doctor's visit of the services that a doctor charges for, and 20% is out of pocket. Part C, of course, there are costs for the Part C or Medicare Advantage plans, depending on which plan you choose, and also the Part D premium, the drug plan premium. There's a cost for that. So I just want to show you, but we won't go through this. If your income is higher than $87,000 or $174,000 for a couple, then you are going to have to pay more depending on which bracket you're in for your Part B premium. And then also for your Part D premium costs more. Whatever your Part D premium costs, a certain sum is added on if your income is higher. But now let me talk about Medigap, because Medigap helps you to pay for some of these costs, not all of them, but for some of these costs that I just showed you. So a Medigap plan is optional. And remember, you can only get a Medigap plan with original Medicare. It covers some or all of the co-pays, co-insurance, and deductibles in Medicare. And the plans vary in what they cover. An F plan and a G plan cover the most, and an A plan covers the least. And so let me just show you what the different things are that they would cover. Then I'll show you the costs of the plans. So you can see the F plan and the G plan, they have little diamonds in them. They have the most diamonds going down. So F plan covers everything that you see listed in the first column. F plans are no longer available to people who are new to Medicare. If you were eligible for Medicare prior to January 1st, 2020, then you would be eligible for an F plan. And also for a C plan, those two plans are no longer available to people who are new to Medicare. So the most comprehensive now is the G plan, which pays for your hospital co-insurance. That's after 60 days, your Part B co-insurance or co-payment. Remember that 80% pays for the first 3 pints of blood. pays for hospice care, coinsurance or copayment, skilled nursing facility care after, after Medicare stops paying, Part A deductible, that's that $1,400 per benefit period, it would pay for that. And then the annual deductible, this is the one where it's $212 this year to have a deductible before your Part B benefits start kicking in. The C plan and the F plan covered that, but there are no plans now, if you're new to Medicare, that will cover that deductible. And then there's something called excess charge benefits. If a doctor is not a member of Medicare, does not take Medicare, then he or she is allowed to charge above the Medicare approved amount. But in New York State, doctors are only allowed to go 5% above that amount. Other states, the highest they can go is 15%, but in New York State, it's 5%, which is a real plus, I think, for us. But the F and the G plan will cover those excess charges, but none of the other plans will. And then some of the plans, including the F and the G, the N, for example, will cover emergency care outside of the US. And none of them have an out-of-pocket limit, except for plans K and L, which will not pay the entire amounts for a lot of these benefits. But once you've paid about $5,800 or $2,900 for the L plan out of pocket, then they pay for all of these benefits 100%. So these are the costs of the plans effective October 2020. These costs vary actually every month. I have to go on to the New York State site to look at the costs to see if there are any changes. And so they may be different by the time you sign up for Medicare, but it gives you an approximate idea that there are a number of companies that sell these plans. You can see that all of the companies listed in the first column sell or will enroll you in a Part G. A Part A and a Part B is, a Plan A and a Plan B and a Plan G. Most of them will sell you a Plan N as well. But you can see there's real variation in the cost. So if we look at Plan G, we can see that Bankers Conseco charges almost $600 for a Plan G, and this is per month. Whereas Empire Blue Cross Blue Shield and United Healthcare AARP charge $270 a month for the same exact Plan G. By law, each of these companies has to provide you with the benefits that I was showing you here. If it's a Plan G, then it's a Plan G. Same for Plan N, same for Plan A and B. So you, I think, want to be careful and look at the costs of these. First, decide what level of coverage you want, and then try and see if you can get the most inexpensive coverage, unless you're particularly wedded to a particular company. Another way that you can get more information on these plans is, again, to go to Medicare.gov, and you can look at all of the individual details of each of these plans and so get more information on them, okay? Now the Medicare Advantage plans, they combine, if you remember, Part A, Part B, and sometimes a drug plan, usually a drug plan. And these are Medicare services provided through a private health insurance plan. You still have Medicare, you must pay your Part B premium, so you don't get out of paying that. But these plans will, you'll see, will have monthly premiums as well, but the monthly premiums will be much lower than the costs of the supplement plans. And some of the plans in this year, all of them include benefits that Medicare doesn't provide: dental, vision, and hearing. You have to be careful because you want to make sure when they say they provide dental, you want to see the extent to which they provide dental or vision or hearing. And again, you can go on the Medicare website to look at the plan details to see exactly what they do provide. The biggest difference, if you remember, between Medicare Advantage and original Medicare is that you're limited in the doctors and the hospitals that you can go to. And so although the premium may seem low, if you have to go out of network for something, then you may end up paying very hefty copays and coinsurance, or maybe not be covered at all. So I'm sorry that this is really small. Usually I hand these out when I'm doing these presentations in person, but I did want to give you an idea of what you can get for the Medicare Advantage plans. These are the ones for 2021. They would start in January 1st. And you can see that a number of them have different monthly premiums, but compared to the monthly premiums of the supplement, you can see some of them have no monthly premium, but some of them have very low premiums. There's one though, Emblem Health VIP Gold Plus, where the premium is $302 a month. All but 3 of these have a drug plan attached to them. And those with drug plans, they all, let's see, all but one, I think, seems to have or 1 or 2 seems to have a deductible, a drug deductible. So those deductibles can be as high as $445, but some of them are lower, like $150, I see, for one. And then there are a few of them, Aetna Medicare Elite Plan, Emblem Health VIP Go, and Humana Gold Plus, which have what's called a health plan deductible. So the plan doesn't start giving you any benefits until you've paid for services out of pocket. The first one is $1,000, the next one is $500, and then that third one, Humana Gold Plus, is an $800 deductible. You can see in the last column, they all give you some sort of hearing, dental, and vision benefits, but you want to go online, I think, and see what those benefits are, because they're going to all be different. And they all have what's called, the second to last column, the in-network MOOP, maximum out-of-pocket limit on how much you spend out of pocket. And once you've spent that amount on Part A and Part B services, then the plan pays for everything. These are the same plans, but I just wanted you to see some of the copays that they have. Some of the plans have an in-network copay if you go to see a primary care physician each time you go. Some of them don't. Well, let's see. A few of them, actually most don't, or a lot of them don't, the $0 copay. If you go out of network, the copay will be different and probably much higher. Then there's a copay if you go and see a specialist. And a lot of these plans have rules as to whether you need to have a referral from your primary care physician to see a specialist as well. There are also out-of-pocket costs for hospital stays. If we take the first one, what this is saying is that for the first 5 days, you pay $395 out of pocket. And then for days 6 through 90, you don't have to pay anything if you're in the hospital. But after 90 days, then you pay the full cost. A couple of them have a cost per stay, like the next one, which has a $1,000 deductible. But if you were to go, after paying that deductible, if you were to go into the hospital, then your stay is $850, no matter how many days. It can even be over 90 days. That's the same for Humana Gold Plus as well. WellCare, Today's Options, Advantage Plus 150A also has a $600 stay. Again, I urge you to go onto the Medicare.gov website and look at these plans, look at the details of the plans. It will tell you what all the different copays are. These aren't your only copays, but it will give you an idea of what each of these plans cover. But the most important thing for these Medicare Advantage plans is to make sure that the doctors and the hospitals that you want to go to are covered in the plan. And I think the best way to do that is to talk to your doctor, or certainly not your doctor, but your doctor's office, and someone in the office, and find out which plans they would take, which Medicare Advantage plans that they would take. And that will then help you to figure out whether that's the direction that you want to go. So to choose a plan, you go to the Medicare website, and you can preview those plans there. If you do need some help in doing that, you can talk to your one-on-one counselor at the library, or you can call our helpline, and I'll give you the number at the end of this presentation. And so when and how do you enroll? There's 4 ways to enroll in Medicare. There's automatic enrollment, initial enrollment, general enrollment, and special enrollment periods. You are automatically enrolled if you're 65 and you're receiving Social Security retirement benefits or railroad retirement benefits. So you're going to get, when you approach your 65th birthday, you're going to get a card in the mail, and it's going to automatically enroll you in Part A and Part B. If you've been receiving your Social Security disability insurance for 24 months or 2 years, or your railroad disability annuity checks for the same amount of time, then again, you're going to receive your Medicare card automatically. Or if you've been diagnosed with ALS, Lou Gehrig's disease, you're going to automatically be enrolled in Medicare the first month that you receive SSDI. Now, when you're automatically enrolled, you're enrolled in Part A and Part B. And you're given the option to turn down Part B because not everybody, Part A is usually free for you if you have a work history, but so you might as well get it. But Part B, you would have to pay your monthly premiums, and not everybody wants to enroll in Part B, even if they're age 65 or over or on disability, because they're receiving health insurance coverage through their own work or through their spouse's work. So you are allowed to turn down Part B if you're working in a company, or your spouse is working in a company that has fewer than 20 employees. However, be careful about turning down Part B, because then Medicare would be your primary insurer. And so you want to make sure that you do get Part B. If you have a disability, the cutoff is not 20 employees, but 100 employees. So if you're working for a company that is that has fewer than 100 employees, then you would still want to get Part B. So be very careful before you turn down your Part B, unless you have employer insurance from you or your spouse's current job. So there's an initial enrollment period. If you don't get your card, if you don't get Medicare automatically, there is an initial enrollment period when you are starting to approach the age of 65. So the initial enrollment period is a 7-month period. It includes the 3 months before your birth month, the month of your birth, and the 3 months following your 65th birthday. And then coverage starts depending on when in your IEP you enroll. So if you enroll before your birth month, then coverage is going to start the first day of your birth month. Even if your birthday, let's say, is at the end of the month, coverage will still start on the first day of the month. If you enroll after your birth month or during your birth month even, then coverage, there will be a gap in coverage. And so you want to start thinking about enrolling in Medicare before your birthday, at least 2 months, but you're allowed to enroll 3 months before as well. Now, there are other enrollment periods, such as the special enrollment period and the general enrollment period. You can enroll in Medicare during these periods of time which are outside the normal enrollment periods, and they're triggered by special circumstances. There are a number of reasons for having a special enrollment period, but the most common one is that people who have been working even over the age of 65 now decide to retire. And so once they retire, they're no longer getting health insurance from the company that they're working for. And so they would have 8 full months to enroll in Medicare. Probably they'll only need to enroll in Part B of Medicare. They probably were getting Part A. and this is called your special enrollment period. The general enrollment period is January 1st through March 31st. So if you haven't signed up during a special enrollment period or your initial enrollment period, then you can sign up during that 3-month period. But your coverage will not start until July. And if you use this general enrollment period to sign up for the first time, then you're going to probably incur a late enrollment penalty. So you want to try and be mindful of either your initial enrollment period, which you have 7 months to do that, surrounding your birthday, or the special enrollment period if you meet one of the requirements for that. Now, you can sign up for a drug plan during your initial enrollment period, but you have to first sign up for Part A and Part B. And you can also enroll in or make changes to Part D coverage during the fall open enrollment period, which is now. But primarily, you want to do it during your initial enrollment period or your special enrollment period. If you use this fall open enrollment period to enroll in Part D for the first time, again, you may incur a penalty for Part D, which would get added on to the premium that you would be paying for your Part D coverage. Now, for Medicare Advantage enrollment, you can enroll in Part C or Medicare Advantage during your initial enrollment period when you first qualify for Medicare, or if you qualify for a special enrollment period. For example, if you retire from your job or lose your creditable health insurance. And again, you must have Parts A and B to enroll. Usually what people do is they enroll in all things together. If you're enrolling in Part A, Part B, then you decide how you want to take Medicare. At that point, you would either get a standalone drug plan, or if you decide to do Medicare Advantage, you would enroll in a particular Medicare Advantage plan with or without a drug plan. Enrolling in a Medicare supplement can actually be done at any time in New York State. It's not the case in every state. Companies cannot deny you coverage or charge you more because of your health status if you're enrolling in a Medicare supplement or Medigap plan. And also in New York State, people with Medicare who are under the age of 65 have the same rights to buy a Medigap plan as people age 65 and older. And you can, again, find these Medicare supplement plans on the Medicare website. You decide which plan you want, and you can call the plan to enroll. Of course, you have to have a Part A and a Part B. And we will be glad to help you to talk through the different Medicare supplement plans. Now, I mentioned these penalties for Part B. If you do not enroll in Part B when you're eligible for it, so let's say you enroll outside of your initial enrollment period or the general enrollment, let's say you enroll in the general enrollment period, then the penalty is 10% of whatever the premium is that year for Part B times the number of full years that you were without a Part B when you were eligible for it. Part D late enrollment period, the way that's calculated is 1% of the national base beneficiary premium for every month you delay enrollment. And I've actually counseled people who have delayed getting their Part D for 20 years, but then now they're on drugs and they need to be covered, but their premium is actually, because of the late enrollment period, it's practically doubled because their penalty is so high. So you have to be careful about waiting too long to enroll in a Part D plan. And then, of course, the extra costs of a Part B premium and a Part D premium come with the higher incomes that I showed you before. So when can I change my plans? I can't do it all the time, but fall open enrollment, which is now October 15th to December 7th, is the best time to change your plan. You can change from original Medicare to Medicare Advantage. You can change from Medicare Advantage to Original Medicare. And if you have Medicare Advantage, you can change the plan you have. Or if you have a standalone prescription drug plan, you can change your drug plan. So now is the time to make any of those changes. And we highly recommend that you take a look at what plans are available now, because things change from one year to another. Premiums go up, they never go down, it seems. Deductibles go up, and your medications may have changed. And so what was covered on the formulary last year for your plan may not be covered this year. So you want to check very carefully to see whether you need to change your plan. And now is the time to do it. There's also something called the Medicare Advantage open enrollment period. So that is from January 1st to March 31st. And this is when you can change your Medicare Advantage plans. You can leave Medicare Advantage and you can switch to Original Medicare. And at that same time, you can actually also enroll in a standalone Part D plan if you decide to take Original Medicare instead of Medicare Advantage. You cannot switch from Original Medicare to Medicare Advantage, and you cannot change your standalone Part D plan at this time. So it's mainly to either change your Medicare Advantage plan or to leave Medicare Advantage and switch to Original Medicare. And then there's also something called SEP 65 for people who enroll in Medicare around the age of 65. They actually have 12 months. If they enroll in Medicare Advantage, they have 12 months to decide to change to Original Medicare. And at that same time, they can enroll in a Part D plan. And then if they wanted to buy or enroll in a Medigap plan, they could, because in New York State, you can enroll in a Medigap plan anytime during the year. So you've seen some of the costs. The premiums are not cheap. There are programs that can help you to pay for Medicare. I'm not going to go into these specifically unless I'm asked about them later. And we can also provide you with information on them. Right now, we don't have the 2021 numbers. We just have the 2020 numbers and eligibility requirements. But there's something called the Medicare Savings Programs, which will help you with Medicare to help to pay the Medicare premiums, the co-pays, and the co-insurance. You need to meet the eligibility requirements. There are no asset requirements, just income requirements. Extra Help is something that subsidizes your drug costs. And in New York State, EPIC is another program that helps you to pay your drug costs. It works with Part D, so you have to have a Part D plan, and you have to be over the age of 65. So people who are on disability and are under the age of 65 and receiving Medicare benefits are not eligible for EPIC. And then there's Medicaid, which covers many things that Medicare does not cover. So to be eligible for these programs, you must meet the income and sometimes asset requirements for each program. And as I said, these are some asset requirements and a little explanation, but I don't think I'll go into that right now. And so finally, where can I go for more help? Because there's a lot of details with Medicare, and I've gone through this, I think, quickly, although I'm sorry, not quickly enough. If you have a phone, you want to take a picture of this page, or if you want us to send these out to you, the whole slide, or just this slide, this is an important slide to look at because you may have specific questions. You can call our HICAP helpline, and somebody will be on the line or call you back and answer your questions or tell you which libraries you can go to or which people you can call through your local library to answer your questions. The telephone form, excuse me, for Medicare or the Medicare website, which I find is actually very useful. Social Security website, which is basically for enrollment into Medicare. And then there's a locator for you to find your Social Security field office that's closest to you, which you cannot visit now, but it gives phone numbers. If you put in your zip code, it'll give the phone number and you'll be able to call Social Security field office to sign up for Medicare You can do that also online, but if you wanted to actually talk to a human being, you can call the field office to sign up. Now, Medicaid assistance, there is a program like HICAP, only it's for Medicaid instead of Medicare. This is the phone number for that. And then there's something called Medicare Rights Center, which is also funded by the federal government. We as HICAP volunteers call the Medicare Rights Center. We have our own phone number to do that, but for clients outside of HICAP, there's this phone number, 1-800-333-4114, and they're extremely helpful. They also have a website, Medicare Interactive, and then to report fraud. If you see that your doctor is reporting things that you just simply don't recognize that you've had those procedures, you can report fraud on this line as well. So I'm going to finally stop, take any questions you might have, and again urge you to call our helpline if you have more questions, or sign up with the one-on-one counselor at your library, and see if there are any questions at all. Thank you very much.
Thank you very much, Lynn. If anyone has a question and would like to unmute themselves, you are more than welcome to do that now. Lynn has also offered to send her PowerPoint presentation by email to anyone who may want it. So you're welcome to contact the library if you'd like a copy of that, but this is recorded and it will be available on our website. I see someone has unmuted themselves. If you have a question or would like to make a comment, please feel free.
Hi, I have a question. This August, I just joined Part A. And my question is, I'm 65. If I do decide to retire, but I want to continue working maybe part-time or an easier job for the next few years, what is the penalty, or should I suffer through and wait till next summer when I'm 66?
Well, if you're being covered by your current job, by health insurance, then you basically do not have to sign up for Part B. And when you're ready to sign up for Part B, what you'll have to do is just provide Medicare with some sort of verification that you were covered all that time. And usually it's a form that your employer has to fill out to say that you were covered, so you did not need to sign up for Part B when you turn 65. Now, if you decide to go part-time, you want to make sure that your employer is paying for your health insurance and that you still have health insurance. And so then you'd be okay. But if they change that and you're no longer covered by health insurance, then you should sign up for Part B, and you would get a special enrollment period to do that, which lasts for 8 months.
I do get to keep my insurance when I retire.
Well, even though you get to keep your insurance, it's no longer insurance from a current employer, and that's the wording of the law. So that's great that you get to keep it, but usually when that happens, Medicare becomes the primary insurer, and your other insurance becomes secondary. But the other insurance usually won't kick in until the primary has paid. Now, that's not the case. I don't know if you work for a school system or federal government, because those usually are the primary insurer. But you'd want to make sure and check with your human resource department to make sure if you don't go on Medicare, if you don't get Part B.
Okay, so there's really no difference between 65 and 66. There's no penalty.
There's only a penalty if there's a gap in your insurance. So if your current employer is no longer paying for your health insurance, then nobody's paying, and so you need to sign up for Part B.
Okay, yeah, they do. If it's 10 years, I do they do pay for the insurance. That's one of the benefits. It's Stony Brook.
Right, but you're no longer a current
Okay,
employee rather. And so if you're no longer, they can be paying for it, which is great, but Medicare only recognizes that you are on health insurance already if it's health insurance from a current employer.
okay,
Okay?
okay. That's good to know.
Okay.
Thank
All right. Anything else?
Oh, I did have one more question.
Okay.
My husband is starting his he's starting to collect Social Security next month. He's a year older than me. And I was told if half of his Social Security is more than what mine is, that I can actually collect half of his.
Yeah, that sounds about right, but that's a Social Security question and not a Medicare question. Which
Okay,
I don't want to, steer you the wrong way.
okay,
So I'm going to defer to Social Security on that. I think you need to check, but that does sound right. Sounds like something that my husband and I also did.
okay, thank you.
Okay. Okay.
Okay, I think that's it. Unless any more questions? Again, this will be archived and will be on our website shortly if you'd like to access the presentation again. And thank you so much, Lynn, for hosting this.
Oh, you're very welcome.
Thank you. I'm going to stop the recording now.
Okay. Have a nice day.